Hello, this is Heather Sweeney, the Associate Director at East Suburban Citizen Advocacy. Welcome to our third training in our series on Pennsylvania's IDD Autism Waiver. In this series, we will look at some basic services in the waiver system and how they can be utilized. The purpose of this presentation is to give you a broad overview of some of the most common services. Please speak to your supports coordinator for further details and assistance in applying these to your waiver. If you would like to look at our other training videos, please refer to our YouTube channel. First service is Assistive Technology. This applies to all waivers. This service is utilized to help people remain independent or gain independence. In some situations, this technology can even replace a DSP staff for certain needs like an overnight staff. At the age of 16 and above, this service can be utilized for independent monitoring to allow the individual to remain in their home independently. Sensors, cameras, medication dispensers, etc. Over 21 years old, hearing aids are then covered by assistive devices. Generators would be covered here also if you were utilizing them in your home to ensure medical equipment doesn't fail. And there are also special situations for lifetime limits of the cost. A special medical script may be needed sometimes, and an assessment may be required for some functions. Assistive technology has become a lot more prevalent, and our waiver is accepting many more things to be utilized through the system. Please check with your supports coordinator for details on what you can use as assistive technology through waiver. Next is our behavior supports. There's a level 1 and a level 2. All waivers do cover behavior supports, though because of the price, some waivers are able to handle more waiver or behavior services along with your other services that you may receive. So base funded, you are able to have behavior services from 0 to 21 years old, or you can receive this through your insurance. The other waivers cover from 21 to the end of life, 120 years old, they say. So that would be your person family directed services, PFDS, the community living waiver, the CLW, and the consolidated waiver would all start covering behavior services at age 21. So before that, you would need to use your insurance, medical insurance, to cover that. There's also a functional assessment that is completed when this service begins, and that function is, or that purpose is to see what the function of the behavior is. So once you figure out what function or purpose a behavior serves for somebody, then your behavior services can start to work on replacing a behavior with another behavior, a more positive behavior or a more requested behavior to still meet the function or the need of the individual. So for example, if somebody is doing something that's harmful to themselves, but they are trying to communicate or they're trying to leave a situation, once you know the purpose of that behavior, then you can give them a different behavior, replacement behavior to utilize, where instead of hitting themselves, maybe they knock on the table 3 times, so just something different as a replacement. But that functional assessment has to occur for them to figure out what is going on, what's behind the behavior. Behavior supports then create strategies. They do developing a behavior plan that is created for everybody who receives the service. So there is a full plan on how to address behavior. The behavior support professional, or BSP, then provides a training to the waiver recipient and their support system. Typically, this includes family, staff, the individual, and then anybody else in their life that they would like included. This way, everybody approaches the behaviors in the same way, which is more consistent, more dependable, and more accountable for the person who is trying to make the change in their life. There's also a thing called a FADE plan that will be mentioned in this service. It basically is there because it's needed as behavior supports is not typically lifelong. So the service is supposed to come in, do their assessment, lay out a plan with interventions and strategies, train everybody, make sure everyone understands and is on the same page, and then they are supposed to start to fade back a little bit so that the natural supports are the ones providing the support of the behavior, and they are there for assistance. You can always bring behavior supports back if they are needed. They are only approved for a certain time frame when the progress is, and then they assess progress. When that is assessed, it is then decided if it is needed for behavior services to continue, to step back, or to be eliminated. Services will not just get pulled, but the idea is to show that a plan was created, trainings occurred, and that the plan is working. As long as the plan is working, we can reduce and have a low occurrence of the behavior, then the behavior specialist is no longer needed. The step down of services will look different for each person in type of fade, the length of fade, the time of that it takes to fade out, etc. For some individuals, this may be a service that is used for a year. For some, the behavior might be very complex and hard to change, or new behaviors might appear as you start to change things. This would require further behavior supports instead of a fade at that time, and they may have behavior supports for just several years. Level 2 comes in when there are serious regressions or no progress is being made. They also can be brought in when there are very complex needs and it is looked at that they need a higher level of attention to the situation. Basically, if you try level 1 behavior supports and it just doesn't seem to be helping in a fair amount of time, then they call in, they move up to level 2 and ask for a different level of assistance. Behavior supports can be provided at the same time as some of our services. For example, supported employment, companion, in-home and community rehabilitation, but that is not a full list. The thinking behind that is not that it's double billing, but that your behavior specialist can help at work during supported employment or in the community during a companion service. Behavior supports will be direct and indirect in services. This means that some billing can occur when the behavior staff is with the individual while they're training people on the behavior plan, when they're collecting and analyzing data, or revising and creating a plan, for example. So some paperwork is going to happen outside of the face-to-face time. This does not include therapy or counseling. This also is not a crisis level service. So keep that in mind when you're looking at that. And this type of service is best sought through insurance if you need the therapy, counseling, or crisis. Hotlines in the community are also available. This next one is community specialist services. It applies to all waivers and all ages. There is an assessment. It is direct and indirect services to assess non-traditional communication needs. Non-traditional communication can be things like different various forms of sign language, lip reading, visual gestural language, paralinguistics, touch cues, texture cues, braille, symbol systems, language or voice interpretation, eye gaze, or partner-assisted scanning, to name a few. Please discuss this with your supports coordinator if you know a waiver participant that communicates in a manner other than speaking or hearing our words. The service is not to exceed 40 hours in a fiscal year and is also not guaranteed to get all 40 hours approved. This, though, is very important in a service because if somebody is having a hard time communicating with us, one, it can lead to behaviors, frustration, stress, And if someone can't communicate that to you, they're struggling sometimes in very intense ways. And if we can come in and do an assessment through this service, then they are able to figure out a different way of communicating and relieving that stress, that frustration, and possibly behaviors that can become pretty involved. The Community Participation Supports, or CPS, you might hear some people call this day program still. This is for all waivers and ages 18 to 120 years old, and providing opportunities and support to waiver recipients to develop skills, participate in activities, build networks, all while exploring volunteering or work ideas. Services are meant to be faded out into a natural or community supports as skills have and confidence increase. Going into the community to practice work skills is part of the service. They work with the personal care and the transportation needs of the client or the recipient of waiver as part of the service. Services can be provided in the community, in community hubs, adult training facilities, older adult daily living centers, and vocational facilities, each having specific rules and differences between them. For those under 21, you want to check with your supports coordinator about when or if the Office of Vocational Rehabilitation, or OVR, should be involved. This has changed throughout the years, and it changes between services and where you're getting services at. So please double check that with a supports coordinator. A variance form may be used to change the amount of time in the community under certain circumstances like medical or behavioral injuries, client choice. This basically limits the time that you are choosing to be out of the facility to learn the skills for employment. If you have consolidated waiver, you only have a maximum of 14 hours a day between companion, in-home, and community rehabilitation and your CPS program. So please keep that in mind if this is one of your services, or all of them are your services. Companion is a very popular service and is used quite often. Companion applies to all waivers, and it starts at age 18 through the end of life. The companion service is available to those who live in their own home or apartment with or without natural supports that require supervision throughout their day. This service allows the waiver recipient to take care of their daily activities with the help of a staff called a direct support professional. This could include help with hygiene, housekeeping, medications, budgeting, meals, things like that. They can be used during sleeping hours when necessary for supervision for health and safety. You cannot use other services for overnight hours for this reason. Examples of how you might utilize overnight would be if somebody cannot evacuate their apartment, but they are capable of living on their own and maintaining their house or apartment with limited help, but they cannot evacuate safely. Then you would have an overnight staff who probably would be a sleeping staff, but in certain situations they may have to be awake. But if there was an emergency, they would then assist the individual. Transportation is included in this service for where the individual needs to go. So if you need to go to a doctor appointment, they would take you along as part of the service and bring you home. If you have consolidated waiver, as mentioned before, this is part of that 14 hours a day rule for companion, habilitation, and CPS programs combined or alone, depending on which services you have. The family can be employed to provide this companion service, but is only allotted 40 hours a week for one family member and no more than 60 hours a week for combined family members. Please check with your supports coordinator for any more detail on that role. Employment services. There's a lot going on with employment services. We can begin working through waiver on employment for people who are 16 years of age and will continue through the lifespan. All waivers can start to approach employment services as well. This assists with advanced supported employment, or ASE, small group employment, and supported employment. Each of these is very detailed, and consulting your supports coordinator is recommended to fully understand each service. But advanced supported employment is the enhanced version of supported employment, which focuses on what jobs you want to try, gaining the skills, and having support along the way to retaining a job. Eligibility: if you're ineligible or closed with OVR, if your supported employment has not been able to secure employment within 2 years, or if you have no job skills or training, you are eligible. In certain situations, advanced supported employment can be provided at the same time as behavior support, companion services, and even residential habilitation. If you think that you are eligible for advanced supported employment due to these criteria and your supported employment not working as it should, please contact your supports coordinator to discuss the advanced supported employment opportunity. So the small group employment services helps a waiver recipient to move into competitive employment within the community instead of a facility. So ratios for this can be 1-to-1 or all the way up to 1 staff to 2 recipients, depending on supervision need of those in waiver. This is done through a mobile workforce. They use workstations, affirmative industry, or an enclave. Transportation to these sites are provided, and you do not have to go through OVR first for this service. No more than 40 hours a week, when not combined with other employment services, is offered as your max. If combined with employment services, they may not exceed 50 hours a week combined. Your mobile workforce is a group of individuals that work at a location in the community with a supervisor. Typical jobs could be like lawn care or janitorial work. A workstation is where there's training and work at an industry site, not in a licensed facility. An example of this would be an assembly line. We also have affirmative industry work, which is working in a business that sells products or services, but over half of the employees do not have a disability. The enclave is the waiver recipient would work alongside an employee without a disability. There is a lot to these services. These are just brief definitions of what they are and what type of situation they would be for work. There's a lot more to them. So if something here sparks your eye as a different environment for work services, for employment, then I would speak with your supports coordinator to discuss what all is entailed further. You'll hear me say that a lot. Home adaptations is a very popular service when it's needed. This can be very helpful and very life-changing to some people or to the families, the caretakers, because it really makes things a lot easier when your home is set up to accommodate disabilities or medical issues, maneuvering around things or preventative things to help you from falling, things of that nature. So this service helps waiver recipients to remain independent by providing the adaptations to their private homes that requires them or that inhibits them from being independent. So where the recipient is for life sharing or a primary residence is what's considered here. If the adaptation is needed due to your disability, if it's needed to help you remain healthy, to remain safe, to make sure your home is accessible to you. Those are some of the reasons why you would be allowed to use waiver to pay for a service to change your house, to make it more adaptable. This must be something that would not be modified for someone without a disability. It wouldn't be something that you wouldn't redo a bathroom just because your bathroom needs updated. Not part of the normal maintenance of the home. You also can't charge the service if it's not part of the room and board. For example, leveling a floor that transitions between rooms or putting in a shower instead of a tub, a wheelchair accessible van are some options that are eligible for this service. Each waiver recipient, every waiver recipient is eligible for $20,000 within a 10-year period. This 10 years starts when you utilize the first service, this service for the first time. The $20,000 starts over after 10 years, or if the individual moves to a new home and needs to utilize the service. Please check with supports coordinator for the process to see if your project can be covered and what the process is. It does most of the time take some time to get it done, so you need your patience, and it does require 3 bids of contractors. Typically, the lowest bid is accepted by the waiver, and the contractor will do the work and waiver will pay for that work to be done. This is a great service. I've seen many people be able to stay in their homes longer and need less assistance just by things like leveling the floor or having that wheelchair accessible van, guards to help you, like handrails to help you pull in and out of the shower, things of that nature. Very helpful. In-home and community supports, or IHCS, you may see it written, applies to all waivers and all ages. IHCS provides direct service, so it has to be face-to-face. And this is to help the waiver recipient learn and enhance or maintain a skill that is necessary for living independently or for being in the community. This can be done in several areas of life, such as maintaining skills in hygiene, medical health, making their life decisions, keeping their home clean, communicating, having good relationships that are healthy, budgeting or paying their bills, socializing, etc. If you have consolidated waiver, you do have to watch out for that 14 hours that we spoke of, where you cannot go over 14 hours in a day of companion alone or in combination with in-home and ability hab, community habilitation, and community participation supports. The family also can be employed to provide this service. It is the same as with companion. You can only get up to 40 hours a week for one family member and no more than 60 hours a week with combined between family members. The service can be provided overnight by awake staff only if continual guidance is needed at a level that companion cannot provide. Typically, this is something like a medical condition that someone needs to be aware of what is going on while the person sleeps or struggles to sleep, seizures or behavioral issues, sleepwalking, something that can be dangerous to the person that is above the health and safety that companion service provides. You can talk to your supports coordinator for further details as mentioned. Living options. So there are different options for living situations if you can't live at home or you can't live on your own. Room and board is applied differently for each of these options. Each has different rates. Supervision rules are different, and which waiver can help you the most or can apply can be different. The services that apply here are licensed and unlicensed residential habilitation. We have life sharing, and we have supportive living. So residential typically is covered by community living waiver and consolidated waiver just because of the cost. It requires you to be, typically most of the time people are older, but we do see some children. So it is eligible with consolidated waiver for someone to be under 18 or under 21. So we cover all ages with consolidated waiver. For licensed and unlicensed residential habilitation, room and board is not included in waiver, and so this must be paid to the provider separately. Basically, this is when the provider has a home with a room for an approved amount of people to live there. Sometimes there's 4 people in a home, sometimes there's 2. Typically, you don't see over 6 people in a community home. It's usually 4 or less. The provider in this situation is responsible to provide or connect the people living there to resources to meet all of their needs. This includes things like food, shelter, activities, socializing, access to health care, maintaining health and wellness, their therapies, their behavior supports, transportation, visitation, everything basically that you would do in your own home that your parents or your caregiver was doing for you. This is now the responsibility of the residential provider. The number of hours is allotted, and which waiver can be used is dependent on the needs group determined by your SIS assessment. Typically, like I said, this is at least community living waiver, but most likely consolidated waiver when you're using residential. Life sharing is one of the other options for living setups. Life sharing is a direct, sometimes indirect service where the individual can live in their private home or private home of a host family. The host family could be your aunt's house, or it could be a neighbor, somebody new to you that you don't know yet. That can vary. This accepts ages from 0 to 120. So like residential, it applies to anybody. Most likely we see adults using living life sharing situations. Relatives can be a host family, and the individual can move in with their aunt, sister, grandparent, etc. There are certain relations that need to meet the relative definition. So you might want to check on that to see if it's considered a relative, as there may be different criteria. Life sharing can be provided up to 24 hours a day and is expected to cover needs of the individual to help them stay healthy, ensure their wellness, provide transportation, and teach or support them with their life skills so that they may stay independent in their home as much as possible. This does, like residential, include healthcare, behavioral health services, therapies, transportation, food, their activities, their socializing, everything that would be included in residential or in your own home. Room and board, much like residential, is not included through waiver. So again, usually people are billed through their Social Security income or their disability check, whatever their income is. When an individual is under 18, life sharing will only pay for the extraordinary care that's needed. So this would mean that life sharing would pay for things that are above and beyond what an average child of that age would require, whether it's a medical need or behavior that's above that expected age group's need. The number of hours allotted and which waiver can be used is dependent on the needs group assessment determined by the SIS, again, just like residential. We also have supported living, which serves ages 18 to 120. So this is more of your adult group. Direct and indirect services are also provided. So supportive living provides the same type of assistance to individuals in their private home to protect their health and their safety, excuse me, by assisting them through daily activities in all areas of life to include behavior services, health and wellness, health care, transportation, socialization in their activities, everything we've mentioned before. The number of hours allotted is also looked at through waiver and through their needs group that's determined by the SIS, and that will be put in the ISP or the individual's plan. The provider would be available 24 hours a day, whether in the home or by phone. The service is basically residential in that the person receives 24-hour support from the provider. So, but they don't always have to be face-to-face like they do in a residential home. So maybe they can spend the night by themselves, or maybe they only need someone to come in 8 hours a day face-to-face. But if something happens, they have somebody to call and somebody who's available. Respite services can be similar to a residential, but do not require you to move in anywhere. Respite services are direct services that are actually used to care for and supervise an individual while giving their regular caretakers time to relax and refresh themselves. Being a caretaker is very taxing and can be very stressing, can very much wear someone down depending on the needs of the person. This service allows that caretaker to take a break, to relax, to breathe, maybe go on a vacation, things like that. Could be also used in a scheduled stay or an emergency. Some people use respite services just to go out to dinner for an evening with their spouse or a friend. The individual can also utilize respite services in-home or out of home. So you can do in-home respite, which is in your house, where someone would come in to supervise and take care of any needs that you had. Where out-of-home respite, you would go to most likely a residential home that had a empty room and they were in between tenants. So you would stay there for like the weekend or maybe a week while your family has the respite from care. The individual's crisis or behavior plan is always followed, as well as their daily routine while they're in respite. They can still go to work, do everything that they do on a normal basis. Room and board is not charged to the individual. It's included in waiver for respite. We also have day units and 15-minute units for respite. So you could utilize 15-minute increments to go out for maybe 2 hours, where if you were staying for a longer period of time of 16 hours or more, 16 to 24 hours would be a day unit. These could be confusing. So if you're interested in the respite service, definitely talk to your SC, have them explain the differences and look at your situation and what might be most helpful in-home or out-of-home respite, as well as day or 15-minute units, what might be most helpful for you. There are limits of the service. So depending on your waiver, Consolidated is eligible for 30 days of respite and 480 units of the 15-minute respite. Your CLW and your PFDS waivers are eligible for 144 units of 15-minute respite each fiscal year. If you are interested in this, like I said, please check with your supports coordinator, as they have much more information and can really gear this towards what works for you and your situation. Now, waiver outside of the state comes up once in a while. For some families, you may have a family member outside of state and you want to go visit them, but having care for your maybe adult child that has the waiver is a little difficult sometimes. So you wonder how this may work outside of the state. So vacations with the family. If you're traveling outside the state for any reason, some of these services can be provided in certain states. So in-home and community supports, residential habilitation, life sharing, supported living, shift nursing, support coordination, specialized supplies, support broker, behavior support, companion and respite all can be provided outside of Pennsylvania. The above services can be provided only during temporary travel, with the exception of respite camp that can only be provided in Pennsylvania, Washington, D.C., or a state contiguous to Pennsylvania. Temporary trip is a vacation no more than 30 calendar days. Waiver does not pay for the cost of the travel. They only pay for the services that are utilized during the travel or the vacation. If the individual and or family of the individual chooses to pay for some of their staff's trip expenses, that should be noted in the ISP that it was the individual, the waiver recipient's choice, and their preference to pay for their staff to come. Staff may pay for their own hotels, their own travel costs, but if it is through the family or through the individual's budget that their staff is paid for, then that should be noted in the ISP. The ISP team should agree and discuss the trip and all of the issues, all of the details, the risk factors that might come up, what to do in medical or safety, behavioral issues, so that a plan is set for things that may occur outside of the norm. The last thing we have here are waiver variances. Now, some of you may never come across these, you may never need them, but there are waiver variances. That's basically an exception from a waiver rule. There is, of course, many rules and stipulations about when and how to use a variance form. It cannot be applied to every rule in the waiver. The variance form can be applied, it can be approved for no more than 6 months at a time. It needs reviewed every 6 months and approved for continuing the service in that manner. Sometimes they are using this for CPS, like I mentioned in the community participation supports. When you are supposed to be out in the community practicing your job skills, you could put in a variance to stay into the facility more often than what is required. Asking for more than one staff to provide services at the time or hire qualified staff, even asking for more hours than are allotted. So like the 14-hour rule or for family, or these exceptions to other rules would be a reason to contact your supports coordinator and ask if the waiver variance could be utilized for that situation that you feel needs to be a little bit different for your situation. This can be a very helpful resource for families that the rule just maybe doesn't quite fit and you just need a little extra support or support in a little bit of a different way. But like I said, there is definitely different rules and exceptions to it that you also need to follow. So to keep that in mind. I thank you very much for watching our presentation. If you would like more information about any of these services, you can contact your supports coordinator, who is the one who can really explain these and get services started for you. Or you can always contact East Suburban Citizen Advocacy at our email address on the screen or our office number, 724-325-3344. Thank you very much.